Good morning, everyone. I am Ernesto Burden, the publisher of New Hampshire Business Review, and it is my pleasure to welcome you to our webinar today. We're going to be talking about, as you know, mental health in the workplace. This is something that has become an ever greater part of our national conversation, our regional conversation. Certainly the pandemic and what everybody went through together during that period of time, I think enhanced the amount and the ways that we talk about mental health. But even prior to that, I think this was a topic that more and more companies were becoming aware of in terms of treating mental health in the workplace in much the same way that you might care for the physical health of employees and understand the physical health challenges of employees. And so with that, we are sponsored today by Harvard Pilgrim Healthcare, a Point 32 health company. And we have Jill Borrelli, Vice President of Behavioral Health at Point 32 Health, and Nina DeMarco, Director of Integrated Health at Amoskeag Health, who will both be joining us. And we're going to begin with Jill, who is going to give us an overview of the topic and some data and trends that I think are really relevant to the conversation today. Welcome, Jill.
Hi, so glad to be here. Okay,
so
we can
let you take it away.
All right, great. We can go to the next slide. Hi, everyone. It's really a pleasure to be here talking about this very important topic that affects all of us. It is behavioral health, and the impact it has on us is part of the human condition. So one of the things I'm just going to start with, this seems really basic, but I am frequently asked, what does it mean? What does behavioral health actually mean? And I want to highlight that I'm saying behavioral health. Sometimes it's mental health. Sometimes people say behavioral health. The reason I choose to refer to it as behavioral health is it encompasses both mental health as well as substance use disorder. Also, there are people in the mental health community, consumers, who feel the word mental is pejorative and behavioral health is less so. So that's the way I'm choosing it. There's no right or wrong way. It's just as an explanation. I'm gonna read something, and it sort of highlights these points about how the CDC defines mental health. And it includes emotional, psychological, and social well-being. I'm going to read, so sorry. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And although these terms are often used interchangeably, poor mental health and mental illness are not the same thing. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person with a mental illness can experience periods of physical, mental, and social well-being. There's often physical symptoms that people may be aware of before identifying them as a symptom of a behavioral health issue. The other thing that I think is really important to say over and over and over again is that we can go to the next slide. This is one of my favorite quotes. It's a little overdone, but Prince Harry saying, the experience I had that once you start talking about experiencing a mental health struggle, you realize that actually you're part of quite a big club. And the reason I think this is a great quote is behavioral health is part of the human condition. And we need to acknowledge and over and over and over again that part of good healthcare and overall well-being includes our mental or behavioral health as well. We know now more than ever that people are recognizing the importance of mental health. Our heads and bodies are connected, and so how we're feeling impacts our overall well-being. It's the main driver when we talk about integrated healthcare. When you go to any type of provider, this is just an example. When you go to any type of provider, they're going to ask you for your whole, medical history. Last year, I hurt my shoulder. I went to see a PT. He was asking about everything because my shoulder, like my head, is attached to my body. So what impacts one part has an impact on my overall health and wellness. We should expect that our providers are going to ask about behavioral health because it's part of our healthcare, and there's nothing to be ashamed of. Talking about it more will only help both ourselves as individuals, our communities, our colleagues, everyone. Next slide, please. So the statistics you're seeing are from the National Institute of Mental Health 2022 report. The mental health crisis, it is really profound, going back to what I was saying about, every age group, every person. People are impacted by, the number of people impacted by behavioral health issues is profound and long-standing. This crisis took hold long before the pandemic, but the pandemic definitely exacerbated this because of the unprecedented loss of life and social isolation. I also want to say that this was magnified in populations that are already statistically vulnerable, such as women, Latinx people, and people, Black and African American people. Increasing the productivity of the economy going forward requires improving people's mental health, which can be done by improving the affordability of mental health treatment, expanding the mental health workforce, and removing barriers to seeking care. Next slide, please. So thinking about it in the workplace, none of these things are is rocket science, right? They are common sense statements. Mental health issues manifest themselves in a variety of ways, affecting all colleagues' well-being, job satisfaction, and productivity. Everything from stress to anxiety and depression to burnout to substance use and sleep disorders impacts how people perform in the workplace. According to a study conducted by Deloitte, the return on investment in workplace mental health programs is an easy equation. What's good for people's mental health is good for business. Workplace mental health programs can improve employee engagement as a collective measure of employees' attitudes, attentiveness, and intensity of effort related to their work and their workplace. And companies that achieve greater returns on invested in activities that support employees along the entire mental health continuum, promoting mental health and well-being among employees regardless of their current state of their mental health. So I think that's another really, really important point, is that behavioral health is not one thing and not like every other health condition and how we live in the world. It's on a continuum. And so what you need is different what a person needs is different at different places. Next slide, please. So I think, I've talked about this a little bit already. It's very important that we work and continue to talk about destigmatizing behavioral health. Despite the commonality of us as humans managing mental health and behavioral health issues, it still is a hard topic to discuss, and people often feel awkward or embarrassed. And I think it's really important that we foster an inclusive professional environment where this, like anything else, we consider this as we're considering how we engage with one another. Here are some very, sort of simple steps, but I want to talk about stigma in general. Stigma, as we know, as I'm sure you know, is when someone views a person in a negative way because they have a distinguishing characteristic or personal trait that's thought to be or actually is a disadvantage. Unfortunately, there are so many negative stereotypes about people with behavioral health conditions. And unintentionally, stigma can lead to discrimination. It can be obvious and direct, such as making a negative remark or assumptions about mental illness or people who seek treatment. For instance, people living with depression are often stereotyped as lazy, and some people judge people with anxiety disorders as cowardly. Many people fear being labeled crazy for simply seeking support from a therapist. none of these characterizations are valid, and all of them are misinformed, cause pain, and prevent people from getting the help they need. Feeling stigmatized by I also want to say that the stigma is again particularly significant in African American communities. According to the National Institute of Mental Health, 30% of African American adults in the US with a mental health condition receive treatment, compared to 43% of white adults in the US. We need to be sensitive to that, and there needs to be extra supports and awareness to help when considering access to care and perceived reluctance within the Black and Brown communities. It's really important, again, that we take every opportunity to I hate the word normalize, so that's probably a bad word, to work to destigmatize these conversations and have them be part of the discussion that people have routinely. And I want to say that by attending this today, you're on the right track. You're starting that conversation. We play a critical role in supporting mental health initiatives in our workplace. This includes everything from managing behavioral health benefits, working with health plans, such as Point 32 Health or Harvard Pilgrim, educating employees about available resources, and promoting a supportive and inclusive work environment. And to create this environment, it's essential that we recognize that these behavioral health issues and promote awareness, reduce stigma, and provide access to resources. This can be done through trainings, wellness campaigns, and a work environment that fosters prioritizing an employee's well-being and work-life balance. I want to say that, an example that I've used in other places is nobody would think twice if one of their employees called in and said, "Oh, I have a stomach bug. I'm not going to be able to, and it just came on really suddenly and I'm so sick, I can't come into work today." We want to make sure that we try to create environments that if someone was brave enough to call and say, "I am having a panic attack and I cannot come into work today," we recognize that as an acute exacerbation of a medical condition and allow people the space and time to take care of themselves in the way that they need to, so that they can come back to work the next day. There are some practical things we can do: promoting awareness, sharing information, whether it's newsletters, emails, posters, and encouraging open conversations, offering resources, having people come in and speak, encouraging work-life balance. I know we all talk about this, and I can't say I always demonstrate it myself, but it is really important that we recognize that the impact of a work and life being out of balance has an impact on people's performance as well as their engagement with our organizations. Making sure we offer trainings. These can be awkward conversations to have, and so having people have the tools to be able to recognize symptoms with themselves or with their colleagues is really important, that people have information. Having wellness activities, I have the privilege of, in addition to the behavioral health department, I also lead the wellness and health engagement teams at Point 32 Health. And so having those kind of wellness activities, whether it's mindfulness training or a Count Your Steps event, is other ways that we help engage people in their overall wellness, which has a positive impact on people's behavioral health. And then, of course, we want to make sure we're creating a supportive environment, that we're building a culture of empathy and understanding where people feel comfortable discussing their mental health concerns with their supervisors or HR without fear of negative consequences. It goes back to my calling in sick if you have a stomach bug, which is an acute episode, just like being able to have an employee acknowledge that they are having an acute mental health or behavioral health crisis and need to take care of themselves or a loved one. And then I think it's also really important is to get feedback from your employees and your colleagues to make sure that you're developing programs that reflect what the needs are. And then stay informed. This is an ever-changing field. And there's a lot more information about services and programs and ways to care for yourself and your wellness, that your well-being, that I think is really important that we engage in as employers, as employees, as people, as parents, as family members, as members of a community. Encouraging work, I know I've talked about this a bunch of times, but encouraging work-life balance for your employees is so important, but it's also equally important to be taking care of yourself. So with that, I'm gonna turn this over to Nina to continue the conversation.
Thank you, Jill. And yes, Nina, please join us. And I also wanted to just jump in quickly and mention to the audience that we do have a Q&A feature here. And please feel free to ask questions as they occur to you. After Nina speaks, we'll be diving in. I have a bunch of questions, and we'll also would love to have questions from all of you. So welcome, Nina.
Great. Thanks so much, Ernesto. And thank you for that, Jill. Again, I'm Nina DeMarco. I work at Amoskeag Health. I'm super excited to be here this morning and to talk about this important topic. On top of the work that I do at Amoskeag Health, I'm also a private practice clinician. So mental health is really near and dear to my heart. So really excited to talk about this topic and just the importance of prioritizing mental health needs in the workplace. So one thing that we want to be really mindful of is that we're doing regular check-ins with ourselves on a weekly, bi-weekly, daily basis to recognize any mental health red flags that might be coming up for you that are really ultimately connected to a shift in your normal day-to-day mood, right? That normal day-to-day baseline that you're at. So these lists of things here are a few things that you can be mindful of if you're noticing any of them. So changes in appetite, right? Not eating as much, missing breakfast, skipping dinner, or possibly eating more than really what you're used to. Sleeping problems, not being able to fall asleep at night, waking up a lot, and then not being able to fall asleep, sleeping too much. Those are all things you want to consider when it comes to your sleep. Feeling numb or unable to experience emotions, right? So really that shift of the normal emotions that you can experience, whether they're bad or good, but noticing that there is a difference in the way that you're experiencing those. Big one, helplessness and hopelessness. Those are two big things that are huge factors of depression. So we really want to be mindful of those when we may be experiencing a mental health crisis. Mood swings, that can be really common too. Daily irritability is a big sign of noticing a shift in your mental health. So recognizing that as well. Persistent thoughts that you just can't quit, right? You kind of can't get them out of your mind. That's a big trigger for anxiety, right? Those irrational negative cognitions that you have a hard time just kind of calming yourself and calming your mind. That's also an important thing to recognize. Interpersonal relationship trouble, noticing that you're having more arguments or disagreements, or you're more irritable with your loved ones, your friends, or maybe it's colleagues as well. So just some of those common things to recognize if you're noticing a shift in any of those. And I also want to talk about, just going off of that as well, as an employee, it's also important to recognize if you're noticing any changes in behaviors with your colleagues. So for instance, if you're noticing colleagues are showing up late to meetings, maybe they're not showing up at all. Someone who usually comes really prepared for meetings, they're not coming prepared at all. Taking more time off than normal, or maybe just simple disengagement in meetings. And so those are some things that you want to recognize as part of, the team that you're in, or your colleagues or your employees. And if you are recognizing those things, it's really important that we support them. We want to be able to practice those reflective listening skills. So just validating, hearing them out, asking them questions. How are they feeling? How are they doing? With reflective listening too, we always want to resist the urge to kind of fix or give advice. We want to just be that ear for them when they're might be going through some challenges. And then that's a good opportunity to explore things together. What are their options? How can you support them? How can your HR department support them? So working together as a team to kind of figure out the best case to support their overall mental health. And then the key thing too is, although you're supporting someone else, it's really important to take care of yourself too. We know in the mental health world, like vicarious trauma is really popular, right? And not only if you're working with patients, but you can take on a lot of stress with working with employees too. So we need to be able to take care of ourselves in that moment too. Next slide. All right, so here are just some basic resources to consider. So normally all agencies have an employee assistant program or EAP, right? So it's definitely important to use that as a key resource moving forward to refer your employees to if they are challenged in any way. SAMHSA, right? Another big one that we refer to, behavioral health line, NAMI, so the National Alliance on Mental Illness. NAMI is great on putting on the Suicide Connect prevention training. So there's a lot of trainers in New England who are trained to come into agencies and provide that suicide connection training. And we actually brought that in at my agency, and it was really great to kind of just provide some education that everybody is a gatekeeper in suicide prevention. And so employees, to your nurses, to your admin staff, anyone can be involved in suicide prevention. So definitely would recommend doing some training around that. And then 988, right? So that mental health crisis line that we can call that is similar to 911, but for mental health challenges as well. So we always want to provide these resources when we're providing support to our employees. All right, so I just wanted to switch gears a little bit and talk about what employers can do to support their employees' mental health. So again, EAP, what does that look like in your agency? What does your benefits and insurance package provide for your employees? We know they focus on the medical health, but what about the mental health? So being mindful of what EAP looks like, how do they get connected to that resource? The other thing is your HR department. How do they respond to employees when employees come to them with mental health concerns? Do they know the right questions to ask? Do they have the right resources to provide to employees? Something to consider when it comes to your HR department. Communication from your leadership team, your managers, your supervisors, your chief officers. What does communication look like? And making sure that it's an organizational response. We know it trickles down from the high leaders, right? So being able to support an organizational response and supportive culture is going to be super important. And also knowing that your managers and your supervisors are trained in that, providing just reflective listening and support. That's going to be crucial when it comes to the day-to-day work when we're providing support to our employees. And, you know, going off a little bit about what Jill mentioned and what we all talk about every day is that work-life balance. But what does that exactly look like in our agencies? What does that look like within your teams and within yourself? You know, as a leader, we're supposed to role model that, right? And so it's important to recognize what that means for our teams, ourselves, and how do we demonstrate that? You know, do we have certain workflows, policies, procedures about vacation, time off, flexibility, leaving early? Those are all things that you want to recognize and be mindful of when it comes to work-life balance. The other thing that we're really used to in the past couple of years is the virtual world, right? We were forced into hybrid and virtual when COVID hit, and so we're really used to it now. And so with that, though, it decreased the human connection, you know, and which ultimately increased isolation for a lot of people. We no longer have a lot of that morning coffee check-ins in the break room, the 15-minute walks on lunch, eating lunch together in the break room, right? A lot of that is missing. So we want to be mindful in our agencies to recognize what we can do to positively connect our employees in a virtual world nowadays. So something really important to consider. And then switching gears a little bit as well, just focusing on what we do here at Amoskeag Health to kind of give you all some examples. So we actually have a committee. It's called the AH Suite Committee, which stands for Amoskeag Health Staff Wellness Engagement and Education Team. And really their priority is to focus on activities, strategies, and other things to support the overall wellness of our employees. So to think back in April was Physical Wellness Month. So they hosted a wellness bingo where people would go out in their personal lives and participate in self-care activities. They'd fill out their bingo card, and then they were able to win prizes, which was super cool. We also practiced daily self-care activities in our daily huddles that we have every morning. And they also presented a virtual wellness fair, which was really cool. So they were able to present Reiki, yoga, cooking demos. We even had like a plant care class. So that was really cool. Recently, about a month ago, we also brought in Jermaine Moore from the Mars Hill Group. If you guys have heard of him, whoever taken a training with him, he is absolutely wonderful. And he came in and presented it to an all-staff meeting about mental health in the workplace. And it was really great because he was able to get everyone engaged, but not only engaged, but a lot of employees were vulnerable and talked a lot about their personal challenges. And it was really great to kind of see people connect in that way and feel safe to kind of share that. And definitely want to give some kudos to Jermaine because he is wonderful at facilitation. So if you have the opportunity to work with the Mars Hill Group, I would definitely recommend it. And then some other things that we do. So every month we have a management meeting and we prioritize opening that meeting up with a mindfulness moment every single meeting. So we'll do different mindfulness strategies at each meeting. It's also really important to do regular check-ins with your staff, not just the scheduled check-ins that you have bi-weekly or monthly, the off-schedule check-ins. I'm a huge component of having like that open door access. My door's usually open all the time unless I'm in a meeting. Come on in, let's chat. How was your weekend? Did you just have a difficult client? Let's talk about it. So having more regular check-ins compared to scheduled check-ins, getting to know your staff on a personal level definitely is going to help that relationship building piece. And also, just to kind of leave you with some basic self-care strategies in order to take care of yourself. As Jill mentioned earlier, our heads are connected to our bodies. It's so important to not only take care of ourselves when it comes to our mental health, but our physical health as well, because they go hand in hand. So focusing on just, the daily diet, increasing your water intake, exercise if you can, attending your annual primary care appointments. That's a huge component of just supporting your overall physical care. Another big piece, connect with your external supports, friends, families, neighbors, your spiritual community, anyone outside of work that you can connect with to really, support that safe, supportive team that you have in your life. And then be intentional. Every single day, set small goals, even if it's, having more water than usual, going to bed a little bit earlier than normal. Really be intentional about your days and having those small goals, because even though they're small, they're actually going to be big in the long term. And then just to end it with, just reach out for help. If you're, again, experiencing any shift in what you're used to with your mood or, anxiety, depression, anything like that, reach out for help. We have many resources. Your agency hopefully will have a lot of resources. So the help is out there. So definitely reach out. That's all set. Thank you.
Thank you. Thank you, Nina. And Morgan, I think you'll need to restart our videos since you stopped them. We'll give Morgan a second to do that. And in the meantime, I'll keep talking, even though you can't see me. So many questions this raises for me, but I think that I want to start with a question that we got from the audience, which may be a little bit of the elephant in the room kind of question for employers who are trying to balance sensitivity towards their staff's mental health with work that has to get done. And so I'll read it because it was a very thoughtfully written question. I understand the importance of mental health and an individual's well-being emotionally and physically. As the number of my employees feel empowered to take those days off, not just crisis days, but to prevent crisis days or to reflect and chill, I find myself with a lot of work that isn't getting done. I feel bad for mentioning it at all. And as a result, a few of us are burning out, keeping the business going. How does one find and maintain balance?
It's such a good question because, again, I think I understand and appreciate that as a manager myself, that you want to create the culture that people can do these things to take care of themselves. But like with anything, it's about balance and if someone is consistently taking time off, whether it's physical or mental health issue, behavioral health issues, it's, I think, worth a conversation as to why. It's reasonable to expect that people are going to have to take care of themselves and their families, but it's also reasonable to expect as a colleague that people are going to show up and do their jobs. And so depending on the circumstances, and this is why it's worth a conversation, there are multiple paths: addressing it directly, engaging your EAP, engaging your HR. When it starts to move from an occasional occurrence to a pattern that's impacting not only that particular employee, but also the organization or you as their colleague. And again, this falls under the heading of caring for your neighbor or your colleague, but also caring for yourself and advocating for your work-life balance.
Yeah,
Thoughts, Nina?
Yeah, I just wanted to follow up. So I agree 100% what Jill has mentioning, and kind of really making it intentional about the conversations that you have with your employees, and just giving some kudos to this participant that asked, because I think that they also shared some vulnerability in this, because I think a lot of times we're feeling this too as leaders, but it's hard to really express that. And so in that case, really, again, is having those conversations with your employees. And even though we're meant to be role models for our employees, we really have to stick to that every day. And yes, there's a ton of stuff to get done. There's priorities, there's things, but we also have to prioritize what's most important in our responsibilities as well. And so really practicing it and role modeling it and taking care of ourselves each day, so we're not feeling the burden of their work. But again, just coming up with the priorities each day and having those conversations with the staff members, and being open and honest, and getting them connected to where they need to go.
Thank you. Related to this question, the topic, Jill, in your data, you had noted that the level of stress and burnout is increasing. And so this is a twofold question. One is, why is it different now? How is work different now than it was 10 years ago, 15 years ago, 30 years ago, that is causing stress and burnout to increase? And then secondarily, what can somebody do on an individual level to address their own sense of burnout? Let's say I feel burned out, but I want to keep doing my job, or I feel stressed, but I want to keep doing my job, which I imagine is the situation for, really high stress jobs like frontline medical workers or soldiers, law enforcement, those kind of physical stress jobs that people are passionate about doing. How do you deal with that stress and burnout if you say don't want to remove yourself from that role?
So let me take the first part, and then Nina, please jump in at any point. I think work is different, right? From 10, 15 years ago. I think the pandemic, as I said before, there were unmet behavioral health needs before the pandemic. The pandemic exacerbated all of it. We all went through a traumatic experience, whether you were, somebody in your immediate circle was impacted by COVID, but just the profound change to life and social isolation had an impact on all of us. And all trauma literature says that the result of a traumatic event doesn't just, the emotional reaction doesn't just occur immediately after, but there are long-term impacts of it. So I think we have to be kind with ourselves, that we have all been through a traumatic experience, and people are reacting in different ways at different times based on their life experience. The other thing I want to say is it's a good thing that we're talking about it more. So this is the silver lining of the pandemic, is that all of a sudden there was a recognition of behavioral health and the impact it was having on people in a way that it has I've been a clinical social worker for a really long time, and I've never had there's never been this amount of conversation about people's emotional well-being in the same way that we're talking about it. And then why the other piece too is our hybrid work environment. That boundary between work and life is a lot more diffuse than it used to be. You went to your office, you did your job, you came home, maybe you got a call, maybe you brought some papers home back and forth. But now as a culture, we have our laptops. You're never really fully away from, or most people, I wouldn't say everyone, but people are never fully away from work. And so it takes, I love Nina's talking about being intentional, because I think, again, how we maintain balance is work is always going to be there. And so how do you intentionally choose when you can completely disconnect? Before we got on this, we were chatting about vacation. And I said, I'm going on vacation in a couple of weeks. And I searched Airbnb for two things: a place that took dogs and one without Wi-Fi, because I know I need a break. And I wanted to make sure that now who knows what the cabin is going to look like, where fingers crossed, but I wanted to be intentional that when we're away, that is not even a possibility, right? Like, I know I need that week. And so making choices like that are really important for ourselves. And then also valuing and respecting our colleagues, making those choices for themselves is equally important. And modeling as a leader that behavior and allowing people to have a night off, to go to their child's Little League game or go out to dinner and not have times that they're away from work, and really be away, even if away from work just means your laptop's in the other room. And then, yeah, Nina, I don't know if you have anything else to add.
Yeah, sure. Thanks, Jill. So thinking of just the changes in burnout and the increase in stress in the workplace, again, we know a lot of it is related to COVID, but I think a huge piece of it because of COVID is our workforce shortage right now, especially in the behavioral health world. It's really, really hard to kind of get some new clinicians in the door. So I think the workforce shortage is really difficult because it's causing the employees who are employed to have more work on their plates, right? More responsibilities, and they're burning out a little bit faster. And so that's where supervisors and managers, again, have to be intentional of like, hey, let's kind of peel back the layers and what are their responsibilities? Can we shift here? Can we shift there? So, really recognizing the employees you do have and placing importance on them so their burnout is not increasing. And then, like I had chatted about earlier, is recognizing your red flags. If you're noticing a shift in your sleep, you're a little bit more irritable, maybe you're more anxious, those things you want to be really mindful of before it gets to the point of full out burnout, because once you're there, it's really hard to get out of it. And so recognizing those red flags, getting the support you need from your external supports, right? That could include a mental health support team. So being mindful of those flags is going to be super, super important. And again, sometimes as leaders, we have to support our employees for self-care. And so I do a lot of clinical supervision with staff, and sometimes I check in, hey, when was the last time you took a day off? When was the last time you had a vacation, right? So kind of forcing them to look back and say, oh yeah, it's actually been over a year since I took a vacation. Okay, maybe it's time. So just again, being intentional, getting to know your staff on a personal level so you can kind of meet them where they're at and have that gentle push to do some self-care.
Okay, and we have a follow-up question that relates still to this question of burnout. Questioner writes, what if a manager chooses not to see issues with burnout among staff?
That happens, right? And again, you can't control someone else's view of the world, but you can still, if a manager chooses and it's your manager, you can still choose to take care of yourself and avail yourself of the resources, and whether it's vacation time or sick time or EAP or other avenues of support within the organization. And I would also venture to guess, because I really believe no one comes to work with the plan to either screw up that day or be mean to people, that if somebody's not seeing burnout, it might be an indication that they themselves are feeling particularly stressed. And so while it doesn't make it okay, I know I try, my practice is to try to give people a little grace in those moments, but still be very clear about what I need to do and take care of myself.
Yeah, 100%, Jill. And, even if your manager does not recognize burnout, I think it's still important to kind of be open and vulnerable to share with them how you're feeling. And so they're at least aware, even if they don't want to support it, you're going to have to find your own ways to support that. And maybe that means going to other supports in your agency, going to your HR department, right? I think that honest, open communication is going to be really really important in order to make any change happen. But I agree with Jill, if someone is not supporting it, it probably is a red flag for them.
How do you, are there, so I know we touched on this a little bit, including Jill, you mentioned disconnecting or unplugging, and it reminded me of a couple weeks ago, I went fly fishing with a former boss, and we were heading up to the mountains, and about a half an hour into the drive, I realized my phone was back on my dresser at home. And after that initial anxiety of not having it wore off, it was an amazing day with absolutely no way to communicate with anybody. Anyway, but what are some other things besides unplugging that people can do? What do you do? And I'll throw out another prompt. Maybe Nina, you had mentioned mindfulness earlier. Can you talk a little bit more about that?
Yeah, there's so many different types of mindfulness strategies. Of course, exercise is a huge one, and it doesn't have to mean going to the gym. It can be, daily walks. It can be stretching in the morning. Mindfulness can go as far as, your own yoga in your living room, attending different Reiki classes. And there's so many different strategies to practice mindfulness. And it can be even just some simple breathing throughout the day. Maybe it's journaling. There's a bunch of different things that you can practice, but mindfulness and grounding strategies I think should be incorporated in everybody's daily self-care because it's such a huge benefit. But, when I think about myself, I think I always go back to exercise. That's something that's super helpful for me. Even if I'm tired in the morning, I know I'll get up and do some exercise because it will just, set my day up really well. So exercise is really, really big. And then disconnecting, like you mentioned, Ernesto, for me, I don't know if anybody else uses Microsoft Teams at their agencies, but sometimes it drives me crazy. And so on the weekends, I kind of delete the app off my phone because I know I actually can't physically look at it if it's not on my phone. And then I'll just re-download it on Monday morning. So just being intentional of setting your own boundaries with yourself is going to be important.
I would say too, there's a lot of tools for people hear mindfulness and get I've heard feedback, right? Like, what does that mean? There are so many tools available for people to practice mindfulness. And I would say at Point 32 Health or Harvard Pilgrim, if you go on our website and search for mindfulness, there are many free tools, videos, classes, recordings, a variety of different things that is available to the public, whether you're a member of our health plan or not. That's one tool, but there are many out there. And so I would also say there's not one thing for everyone, right? That I know for me, on the weekend, chilling out with a good book for a few hours in the hammock is like the best thing I can do for myself. And so that I make sure I prioritize that in my weekend plans. When my children were young, now they would shudder at the thought of doing this. They're both young adults. But when my kids were young, we used to plan days off. And it would be a weekend day that we as a family would choose not to schedule anything and be just kind of together as a family without we didn't do chores, we weren't doing laundry, and but we were very thoughtful and planful. We would put it on the calendar and spend that day kind of being together again intentionally. That worked for me. I love cooking, like baking bread in the winter. It makes me so happy. I think it's not one thing that will work for all people. You have to figure out what's going to work for you. And then most importantly, it's prioritizing doing it. I take pottery once a week. I'm terrible. I'm a terrible potter, but I have it blocked in my calendar. I will not do a meeting or an event or anything on Wednesday nights because I'm doing pottery, because for 3 hours I play in the mud, and that makes all the difference in the world for me. All the other days where I work long hours and work hard, I have a big job and a lot of responsibility, which I love, and I also love not doing.
That seems like a good example of leading by example. And I think that sort of raises another topic for me, which is we had talked earlier about destigmatizing discussions around mental health. And as you were describing that, I was thinking of, I don't know if you ever read a book by Scott Stossel, who was the editor of The Atlantic magazine. He wrote a book called My Age of Anxiety, which was a very candid look into his experience with clinical anxiety. And he, I thought when I read that book, it was a revelation because it was somebody who was a very high performing leader in the field I worked in, acknowledging this. And it did two things. One is it felt like it destigmatized the conversation, but it also suggested or showed or demonstrated that you could deal with this particular situation and still be high performing at the national, international level. And maybe could you reflect on that a little bit?
Yeah, sure. You know, it's like it's something I was talking about what is the definition of behavioral health. It's the human experience, right? Like it is a common human experience, and people with mental health or behavioral health issues are not only that. Right, that is one aspect. Just like a person dealing with a chronic disease is not only a diabetic, right? They are also many other things and people. And I think recognizing this as part of being human, the common experience of being human, does a lot towards destigmatizing and also having real conversations about it and valuing it for yourself and for your colleagues makes a huge difference.
Yeah, and simple as just changing your language can be a huge benefit when it comes to stigma. And the simple thing of changing the word addict to someone who has a substance use disorder, or schizophrenic to someone who, oh, this person has a mental health diagnosis. The simple things of changing your language is going to be huge when it comes to destigmatizing mental health, and especially in the workplace as well. And I always say, like, we all take a part in this, and it's not just the behavioral health providers here at Amoskeag Health that can do the support and do the work. We have a lot of employees coming to us and say, well, you're the expert. Sure. But we can all play a role in providing support to our fellow employees.
That's right. I do think language is critically important. Just like when I was talking about behavioral health versus mental health, I think we use the word crazy a lot. And I think, again, being intentional about the unintended consequences of language and regular everyday conversation matters, whether it's about behavioral health or so many other topics as well.
We have a sort of related question, again, to the stigma. This is great that people are commenting right on the heels of each of this. This is from our friend of the brand, Rebecca Sanborn. Thank you, Rebecca. How are you doing? What do you say to someone who wants to be open about their mental health diagnosis in an effort to reduce that stigma, but is afraid of the possible backlash of being viewed differently? How do you balance those two concerns?
That's a good question. That is a good question. I think it's important. Again, we have to role model. So really practicing that reflective and supportive listening if someone does come to you and share their mental health diagnosis, that they're open about it, and also make sure that you're emphasizing that there is confidentiality in that room. This is a safe environment. That's something that I really like to try and set a foundation with new employees or new clinical staff that I'm supervising. This is a safe environment, and boundaries should still be held, just like therapist and client boundaries, unless there are safety concerns and things like that you have to break confidentiality. But just making a foundation, creating a foundation of safety and vulnerability, open, transparent communication, validating and supporting, I hope can lead in them to kind of building that trust with you, knowing that information is going to stay confidential unless it meets certain things that you have to break privacy for.
Yeah, and I would say too, what a brave person to want to have that conversation and to raise that question. And in the workplace, I think there's this struggle, right? Because you want to create open, honest communication, but you also want to help people maintain the right boundaries and privacy so that it's not during the conversation that there's a problem, it's the next day that they still feel good about what they shared and how they shared it. I also think it's really important if any employee is sharing any health information, that as an employer, we're not treating how we respond to someone sharing a behavioral health diagnosis any differently than we would treat someone sharing a medical diagnosis, with confidentiality and respect.
Well, I think all of that totally makes sense, and I would add, as you're describing it, it also occurs to me that there's maybe, and this almost becomes more of a DEI or a DEIB discussion than strictly behavioral health, but there is an element of privilege that may come into play in terms of who can talk about it without repercussions and who can't. So, for example, if I talk about issues with anxiety, I have a very long work track record that I can point back to and say, like, I don't know if I would have been as comfortable talking about that when I was 22.
Of course, I think every conversation really in the workplace is infused with DE&I, right? Like DEIB, as it should be. And there is such stigma associated with behavioral health, and a long history of people with known behavioral health disorders, ideas being discounted or only explained within that context. So it is brave, it is different, and it is something that we have to practice, both again in terms of our language and how we respond when people share that information. And like with everything else, there is absolutely privilege based on who you are, where you are in your career, in your life, in your organization. So that always has to be recognized as part of the conversation.
And as I think both Jill and I had mentioned too, this is an organizational response. This is not just a response from your direct supervisor or manager, right? It really kind of has to start at the top of your chief officers and trickle down to your leaders, your managers, your supervisors, your team leads, to the employees, in order to kind of create that safe, positive culture that they trust, that they can come to work and share maybe that they're just having a bad day. So it's the whole organization. It's not just one person.
Yes. Yeah, and even if I'm reminded of a session that we had on this internally as part of our DE&I programming, and the encouragement to managers to just ask that question, or to even whether you're a manager or not, if you're just to ask somebody how they're doing, so they don't have to come and tell you they're having a bad day. We have another question here. This one is also almost, again, I think it's sort of behavioral health meets DEI question. Somebody asks, how does someone properly react to the comment, "You're strange"?
What was it?
You're strange. If someone were to tell you you were strange at the office.
I don't know if there's a proper way to react, right? That is your reaction is your reaction. That it would be the same as saying to someone, I suppose it's context, but the way it's written here, that doesn't seem like it's meant in a complimentary way. So I think in all those situations, you can take it as pejorative, or you can take it as an opportunity to say, yes, I am, but I'm happy, or whatever it is. It's also okay to say, that's not an okay question. Like I'm uncomfortable with that statement, because both can be true, right? Like, I'm sorry, whoever was in that situation had that question, or witnessed someone being told that, because that's an awkward situation that it's okay to not be okay with.
Yeah, and I'm not sure like what that person's intentions were behind that comment, whether it was good, bad, or whatnot. But currently with some of my staff, I'm working on a lot of conflict resolution, and so it's really important to kind of coach your employees. If another employee said something that upset you, talk about it. Ouch, that hurt. Like being open and transparent, and not kind of like just bubbling it up, because that can sometimes be worse. So conflict resolution and coaching around that, on how to have difficult conversations, whether it's a colleague, a manager, or a supervisor, but that's going to be crucial in the long run when it comes to those types of things.
Okay. That was a great answer, both of those. So we're getting near the top of the hour. It's hard to believe how fast this conversation flew by. And thank you both. I think one other question that I had jotted down here that came out of some of our earlier discussions was, for those who are really, there's always a first time that you ask for help. What happens? Like, what if somebody's out there, or if they're, I guess if somebody's out there who has never asked for help but read your list and said, oh gosh, I fall into this category, I should seek help. What happens next? What and I realize that's a really broad question, but maybe just some general examples of like what happens
if an employee comes to us and asks for help.
Or if, as an employee, you come and you ask for help, or you go to your EAP, or
you recognize that you need help. Is that what you're saying?
Exactly. Yeah.
Yeah. So again, I think it starts with that direct conversation with your supervisor. So for an example, for me and a staff member, I was noticing some burnout red flags with a staff member, and I kind of had some gentle conversations, and they finally came to me and said, yeah, I'm struggling. So a lot of reflective listening, support, check in about their external supports too. Again, like who is in their life that can support them. And then it would be giving them those options, right? And so depending on what type of help they need is going to depend on the resource they need, right? If they are in some crisis that moment, if maybe there's active suicidal ideation, that's going to change your direction on what type of resources you're going to give, right? But if it's more of like, hey, I'm noticing I'm struggling, I need some extra support. Okay, let's get you connected to EAP, direct them where to find that number and whatnot. And also give them more basic resources in the community, like your local mental health center and whatnot. And HR can do a lot of that too. But if you have the resources, it doesn't hurt to give. So starting with that conversation is crucial.
Yeah. And then I think as an individual, if you're seeing this in yourself, to reach out to your family and friends, your pastor, if that is the right person for you, to call the EAP, because oftentimes EAPs provide providers. If you're looking for a provider, to call your health plan and ask for help to identify the right behavioral health provider, talk to your PCP. There's lots of options. And it's very important to follow the path that is comfortable to you, but to reach out. That someone, if you notice that you're struggling, don't struggle alone.
And well, that I think is a perfect sentiment on which to close today. So I would like to thank you both, Jill Borrelli, Vice President of Behavioral Health, Point 32 Health, and Nina DeMarco, Director of Integrated Health at Amoskeag Health. Thank you to Harvard Pilgrim Healthcare, a Point 32 Healthcare, a health company, for sponsoring today. And thank you to all of us to all of you who joined us today. We appreciate you, your great questions, and your attentiveness. Be well, everyone. Have a wonderful rest of the day.
Thanks, everyone.
Bye.